Hello friends, welcome back to Breastfeeding Nurtured, all you need to know. In our first session, we explored how breastfeeding safeguards the health of both mother and child. Today, we will dive even deeper into the incredible world of breastfeeding by exploring its numerous benefits and the essential nutrients it provides. Whether you are a new parent, expecting, or just curious, this session will give you valuable insights into why breastfeeding is so vital for both mother as well as baby. Let's embark on this journey to understand the amazing advantages of breastfeeding and examine the crucial nutrient it supplies, highlighting why it remains the perfect choice for the infant feeding. The benefits of breastfeeding extend far beyond merely nourishing a baby. Breast milk provides complete nutrition for infants up to 6 months of age, meets nearly half of their nutritional needs from 6 to 12 months, and covers up to one third of their requirements from 12 to 24 months. Additionally, breastfeeding offers comprehensive health advantages due to its natural anti-infective properties. In contrast, formula milk derived from animal milk, soybeans, and vegetable oils are modified to mimic human milk, but they fall short of being ideal. To understand why breastfeeding is superior, let's examine the nutritional components of human milk and explore how they support optimal physical and mental development in children compared to formula milk. The key nutrients crucial for nutrition vary between different types of milks. However, all the milks contain fat, which provides energy, proteins for growth, and a milk sugar called lactose, which also provides energy. The differences in the nutrients will be discussed in more details later. Amongst these, human milk has the highest lactose content and the lowest protein content compared to the animal milk, whether it's a cow's milk or a goat's milk. The fat content is nearly the same across all types of milk. We will now explore the major differences in the quantity and quality of these nutrients in different milks to understand why human milk is the best choice for infants. Proteins in animal milk are not only more abundant but also differ in quality compared to human milk, as you can see in this slide. Animals grow faster than humans, necessitating a higher concentration of proteins. For instance, pregnant woman gives birth after 280 days of pregnancy, and her newborn, weighing about 6 pounds at birth, typically weighs about 12 pounds by 6 months and around 18 pounds by 1 year of age. Typically, a baby weight doubles within their first 4 to 6 months and triples within their first year. In contrast, a cow gives birth 285 days after becoming pregnant. Most calves weigh between 65 and 90 pounds at birth. You can see here. From 24 hours to 60 days of age, a calf's weight doubles, and from 61 to 120 days, it gains about 2.2 pounds daily. From 121 to 180 days, the daily weight gain is about 2 pounds. Accordingly, by the end of 1 year, if we calculate, a calf weighs about 315 to 340 pounds. This rapid growth illustrates the significance of proteins, that is, the higher level of proteins in animal development. Another disadvantage of the high protein content in animal milk is the difficulty for the human baby's immature kidneys to excrete the extra waste from these high protein levels. Now, proteins in human, animal, and artificial milk is one of the important nutrients which is required for growth, which is broadly classified into casein and V fraction. Colostrum has a V to casein ratio of 19 to 10. compared with 60 to 40 in mature milk and 20 to 18 cow's milk. You can see in this slide. V is the faster protein supplement because its amino acids are absorbed quickly, while casein is a slower supplement since it's digested more slowly. Casein forms thick, indigestible curds in a baby's stomach. This is the reason why infants on human milk demand feed sooner than on bovine milk. There is some casein in human milk but less than in cow's milk, and it forms softer curds that are easy to digest. The whey proteins in human milks are different from animal milks. Human milk contains alpha-lactalbumin and cow's milk contains beta-lactalbumin. Let's analyze the importance of alpha-lactalbumin present in whey proteins of human milk. Now you can see here that alpha-lactalbumin represents 20 to 25% of the whey proteins in bovine milk, whereas it represents 40% of the whey proteins in human milk. In terms of its percentage of the total proteins, the difference between bovine and human milk is more marked. That is about 3.5% compared with 20%. The key biological function of alpha-lactalbumin is regulation of lactose synthesis and production of the aqueous phase of milk because of by its critical functional roles as a component of the lactose synthesis complex. Now, alpha-lactalbumin, which is the most abundant whey protein in human milk, contains higher level of tryptophan, lysine, and cysteine than other proteins. Animal milk and formula milk may lack the amino acid cysteine, and formula milk may lack taurine, which neonate needs especially for brain growth. Taurine is now sometimes added to formula milks. In addition, peptides released during alpha-lactalbumin digestion have antimicrobial and prebiotic activities that stimulates beneficial bacterial colonization of the gut while inhibiting the growth of pathogenic bacteria. The anti-infective properties of whey proteins in human milk are because of lactoferrin, which binds iron and prevents the growth of bacteria which needs iron, and lysozyme, which kills bacteria, as well as antibodies, that is immunoglobulins, which are mostly IgA type. Other important anti-infective factors include the bifidus factor, which promotes the growth of Lactobacillus bifidus. Now, Lactobacillus inhibits the growth of harmful bacteria and gives breastfed babies stools their yogurty smell. Breast milk also contains antiviral and antiparasitic factors. Now, babies who develop intolerance to animal proteins may develop diarrhea that may become persistent. Babies who are fed animal milks or formula milk are also more likely than breastfed babies to develop allergies, which may cause eczema. A baby may develop intolerance or allergy after only a few artificial feeds are given in the first few days of life. In recent years, another biological activity of alpha-lactalbumin has been highlighted and designated as human alpha-lactalbumin made lethal to tumor cell, abbreviated as HAMLET, that is Hamlet, which has shown to kill numerous types of cancer cells. Before discussing the differences in fats of various milks, let's have a look at the types of human milk. Colostrum is the special breast milk that woman produces in the first few days after delivery. It is thick and yellowish or clear in color. As mentioned earlier, it contains proteins which are more than later milk. After a few days, colostrum transitions into mature milk. There is a larger quantity of mature milk and the breast feels full, hard and heavy. Some people refer to this as the milk coming in. Fore milk is the thinner milk produced early in a feed. It is produced in large amounts and provides plenty of protein, lactose, water, and other nutrients. This is why babies do not need additional drinks of water before they are 6 months old, even in hot climates. Hind milk is the whiter milk produced later in a feed. It contains more fat than foremilk, which is why it appears whiter. This fat provides much of the energy in a breastfeed, making it important not to take the baby off the breast too quickly. If the child consistently receives foremilk because they are taken off the breast too soon, they will demand feeds more frequently and might not gain sufficient weight. Kindly note that there is no sudden change from fore to hind milk. The fat content increases gradually from the beginning to the end of the feed. Let's explore the unique properties of colostrum and why it is so important. Present in the breast at birth, colostrum is crucial for a baby's initial feeds. It provides all the essential nutrients needed before the arrival of transitional milk and acts as a powerful immune booster. Colostrum plays an important role in protecting newborns from infections thanks to its rich content of anti-infective proteins and white blood cells. It serves as the baby's first immunization, shielding them from microorganisms encountered post-delivery. This early protection helps prevent bacterial infections, reduces the risk of sepsis and death, and acts as the newborn's initial line of defense against diseases. Additionally, colostrum is packed with essential vitamins, particularly vitamin A, which significantly reduces the severity of infections. Colostrum also helps prevent jaundice due to its gentle laxative effect, which aids in clearing meconium, the baby's first stools, from the gut. This process facilitates the removal of bilirubin from the body, thereby preventing severe jaundice. Moreover, colostrum helps prevent intolerance and allergies. It contains hormones and growth factors such as epidermal growth factor that promote the growth and maturation of the intestinal villi. This development helps prevent the absorption of undigested proteins that could cause intolerance and allergies. Therefore, it is crucial for the babies to receive colostrum before any other foods or drinks. Most of the brain growth is completed by 5 to 6 years of age. The human brain is nearly 60% fat. DHA and AA represent approximately 25% of the total content of brain fatty acids and are constituents of the lipids of cell membranes that form the gray matter. Fatty acids are among the most crucial molecules that determine the brain's integrity and ability to perform. Now, essential fatty acids, which we call as EFAs, are required for maintenance of optimal health, but they cannot be synthesized by the body. The EFAs, particularly the omega-3 fatty acids, are important for brain development during both the fetal and postnatal period. Docosahexaenoic acid DHA is needed for the optimal functional maturation of the retina and visual cortex, with visual acuity and mental development seemingly improved by extra DHA. Now, the human milk lipid composition is unique and supplies specifically long-chain polyunsaturated fatty acids, which we call as LC-PUFAs. In particular, arachidonic acid and docosahexaenoic acid. Arachidonic acid is the most predominant long-chain polyunsaturated fatty acid in human milk. These essential fatty acids are not present in animal milks but may have been added to formula milk, and it is not certain whether the baby's body uses them in the same way as those in the breast milk. Human milk also contains an enzyme lipase, which helps to digest the fat completely and more efficiently by the baby's body than the fat in cow's milk or formula milk. This enzyme is not present in cow's milk or formula milk. Human breast milk contains two types of carbohydrates, Lactose and oligosaccharides. Lactose, a disaccharide, is the main carbohydrate in breast milk and serves as an excellent source of slow release energy. It also plays a crucial role in shaping the intestinal microbiota and promoting brain development. Notably, none of the milks contain starch. While starch is an important nutrient for older children and adults, serving as a primary component of staple and many complementary foods, young babies cannot easily digest starch. Therefore, starchy foods are not suitable for infants in the first few months of life. Breast milk stands out by having higher lactose content compared to other milks. And human milk oligosaccharides, which are also called HMOs, are the third most abundant component following lactose and lipids. Human milk has a high content of oligosaccharides, not only in cholesterol, which is 20 to 23 gram per liter, but also in mature milk, which is about 12 to 14 grams per liter. Cow's milk has a content in oligosaccharides that is about 20-fold lower than that found in human milk, that is 0.7 to 1.2 gram per liter. In colostrum, human milk oligosaccharides are the third most abundant component of breast milk after lactose and lipids. HMOs in the human breast milk are a complex mixture of more than 200 non-digestible and non-nutritional carbohydrates. Among the various compositional differences between human breast milk and cow's milk, one of the major differences is the presence of HMOs in human milk, which are virtually absent in cow's milk and infant formula. The amount and composition of HMOs vary among women also during the lactation period. Generally, the total HMO concentration is higher during the early stages of lactation and decreases within the first 3 months. Now, intestinal health and barrier function are considered to be the first line of defense in innate immunity. Several studies have reported these beneficial effects of HMOs. HMOs are intrinsic components that affect the gut microbiota by providing an energy source for the beneficial intestinal bacteria, thereby resulting in modification of the intestinal microbiota. HMOs improve the host defense mechanism by strengthening the gut barrier function, thereby resulting in anti-adhesive effect against pathogens. HMOs are responsible for the modulation of the intestinal epithelial cell, responsible by reducing the cell growth and by inducing differentiation and apoptosis. One of the important properties of HMOs is the immunomodulation. HMOs directly modulate the gene expression of intestinal cells, leading to changes in the expression of cell surface glycans and other cell responses. HMOs and their metabolic products such as sialic acid have a role in brain development, neuronal transmission, and synaptogenesis. HMOs are a source of sialic acid, which is an essential nutrient for optimal brain development and cognition. Now, here's another component which is very important, or nutrient you can say. Although different types of milk contain similarly small amounts of iron, the absorption rates vary significantly. Only about 10% of the iron in cow's milk is absorbed, whereas approximately 50% of the iron in breast milk is absorbed. As a result, babies fed on cow's milk may not receive sufficient iron, often leading to anemia. Some brands of formula milk have added iron to address this issue. However, this added iron is not well absorbed, requiring a higher quantity to ensure the baby receives enough to prevent anemia. This excess iron can facilitate the growth of certain bacteria, potentially increasing the risk of infections such as meningitis and septicemia. This slide compares the amount of vitamins in human and cow's milk. The important roles performed by the B-complex water-soluble vitamins involve several cellular functions in which they work as coenzymes in different catabolic and anabolic enzymatic reactions. B vitamins in human milk as compared to cow's milk is shown in the graph. For some vitamins like vitamin B3, that is nicotinic acid, and vitamin B9, that is folic acid, the amount in human milk is more than in cow's milk. But for most of them, the amount in cow's milk is 2 to 3 times higher than in breast milk. These high levels exceed what a baby needs, indicating that it is not a cause for concern. In addition to some B vitamins, human milk contains significantly more vitamin C than in cow's milk. Vitamin C, an important antioxidant and free radical scavenger, is present in human milk at 60 milligram per liter, a considerably higher amount compared to cow's milk. This vitamin aids in intestinal iron absorption. It is essential for collagen formation and offers a protective effect against atopic dermatitis in high-risk children. Let's also compare the fat-soluble vitamins in human milk to those in cow's milk. Human milk has a higher vitamin A content, 60 microgram per deciliter, compared to cow's milk, which is 41 microgram per deciliter. Vitamin A is crucial for the children's nutrition, influencing growth, immune development, eye health, and maintaining epithelial integrity. Its content in milk is closely related to the total fat content, which is diet dependent. Breast milk can provide a significant portion of the vitamin A needed by the children even in the second year of life. Both human milk and cow's milk have similar, though insufficient, levels of vitamin D. This group of compounds is vital for calcium and bone metabolism, acting as a hormone with anti-rachitic properties. Therefore, breastfeeding babies often require vitamin D supplementation. Human milk is rich in vitamin A compared to cow's milk. It's almost double, more than double. As a major natural antioxidant, vitamin E protects cell membranes against oxidation and peroxidation processes. Human milk contains a very low level of vitamin K compared to cow's milk. Due to this low content, newborns are typically given a vitamin K injection to prevent deficiency. Besides nutrients in human milk, breastfeeding has important psychological benefits for both mothers and babies. Breastfeeding fosters a deep, nurturing bond between mother and baby. The physical closeness and skin to skin contact enhances the emotional connection, providing a sense of security and love for both. The act of breastfeeding releases a hormone which promotes feelings of happiness as well as fulfillment, enhancing the emotional satisfaction of the mother. Babies who are breastfed tend to cry less as they feel more secure and comforted by their mother's presence and the act of nursing. This sense of security is crucial for the baby's emotional development. The hormonal changes and the physical closeness, which is associated with breastfeeding, encourages the mother to be more affectionate and responsive to their babies. This increased affection contributes to a stronger emotional bond and better infant care. The strong emotional connection and the sense of responsibility that comes with breastfeeding can reduce the likelihood of maternal neglect or abuse. The bond formed through breastfeeding often leads to more attentive and nurturing parenting. Besides emotional bonding, studies have also shown that children who were breastfed tend to score higher on intelligence tests later in childhood. The nutrients in breast milk, along with the cognitive stimulation from the mother during feeding, contribute to better brain development and cognitive functions. The emotional security provided through breastfeeding, along with the beneficial components of breast milk, supports healthier psychological and emotional development, leading to better behavior and social skills. Now, to conclude, Breastfeeding fosters a strong, loving bond between mother and baby, enhancing emotional satisfaction and affectionate behavior from the mother, reducing crying and increasing emotional security for the baby, while also contributing to better cognitive development and fewer behavioral issues in later childhood. Let's have a look into the drawbacks associated with artificial feeding following our discussion on the benefits of breastfeeding. This slide precisely outlines the risk of artificial feeding. Artificial feeding may hinder the formation of a strong bond between the mother and the baby, potentially impacting the development of close, loving relationships. Babies who are artificially fed are at a higher risk of developing illness such as diarrhea, respiratory infections, and other infections which may persist. We have already seen that babies who are artificially fed have a greater risk of succumbing to infections, especially within the first month of life compared to breastfed babies. Artificial fed babies may receive inadequate nutrition either due to insufficient feeding or diluted formula, leading to malnutrition and an increased likelihood of vitamin A deficiency. Artificially fed babies are more prone to developing allergic conditions like eczema and possibly asthma. There is a possibility that artificially fed babies may develop intolerance to animal milk, experiencing symptoms such as diarrhea and rashes. The risk of certain chronic diseases such as diabetes is heightened in artificially fed babies. Babies fed artificial milk may consume excessive amounts, leading to obesity. Artificially fed babies may exhibit slower mental development and lower scores on intelligence tests. Mothers who opt out of breastfeeding may face various health risks, including earlier onset of pregnancy, postpartum anemia, and a higher likelihood of developing ovarian or breast cancer, as well as type 2 diabetes. Breastfeeding for 12 months and beyond offers significant health advantages to both infants and mothers. To help mothers continue breastfeeding for 2 years or more, the World Health Organization provides the following guidelines. For the first 6 months of life, exclusive breastfeeding ensures that a normal full-term baby receives all the necessary nutrients and hydration. After 6 months, breast milk alone is not sufficient. Infants should begin receiving complementary foods alongside breast milk served by a cup or spoon. Breast milk continues to be a vital source of energy and high quality nutrients even after 6 months. In the second year of life, it can provide up to 40% of the child's daily energy needs and half of their protein requirements. While breast milk does contain some iron, the iron reserves accumulated during the first 6 months are eventually depleted. Complementary foods are necessary to bridge the gap between the child's iron requirements and what breast milk can supply. In the second year, breastfeeding can cover 38% to 75% of a child's vitamin A needs, depending on the mother's vitamin A levels and the amount of breast milk consumed. This helps protect the child from vitamin A deficiency. Breast milk can fulfill almost all of the child's vitamin C requirements as long as the mother is not deficient in this vitamin. The unique nutrients provided by breast milk may not be easily sourced from a typical family diet. Continued breastfeeding during the second year is crucial in preventing malnutrition, particularly in vulnerable children. These guidelines highlight the essential role of breastfeeding in promoting the health and well-being of both infants and mothers, emphasizing the need for sustained breastfeeding support and education. What do we learn from the session exploring the benefits and nutrients in human milk? Human milk is highly recommended as the primary food source during the first 6 months of life. Human milk is the ideal choice for infant feeding as it is a vital source of nutrients that supports the optimal growth and development of newborns. It contains a diverse array of bioactive molecules that play numerous beneficial roles. These include protecting against infections, aiding in the maturation of the gut microbiota, and promoting nervous system development. It contributes significantly to both short-term and long-term health outcomes. Moreover, currently no adverse effects have been associated with the consumption of human milk. On the other hand, cow's milk contains high levels of beta-lactoglobulin, a primary allergen that can trigger allergies in infants, making it unsuitable for children with cow's milk protein allergies. In session 2 on breastfeeding, exploring the benefits and nutrients, we saw that breastfeeding provides essential nutrients such as proteins, fats, vitamins, and minerals vital for an infant's growth and development. It contains antibodies that enhance the baby's immune system and DHA, which supports brain and vision development. Additionally, breastfeeding promotes healthy digestion and helps establish a robust gut microbe. In the next session, we will understand the dynamics and physiology of breast milk production and intake. We invite you to share your thoughts, questions, or any topics you would like us to cover in future. Please feel free to reach out to us via email at rajendra_gulati@hotmail.com. Your feedback and inputs are invaluable to us as we strive to create informative and helpful content. Thank you for joining and looking forward to continuing this journey together. Have a wonderful time.